Hi, welcome again to this series of short videos on mental health. We have covered deep breathing, diaphragmatic breathing for relaxation and for releasing any tension or any stress so that your mind can think clearly and you can feel better. You get a sense of getting better and feeling better physically and emotionally. That's what happens when you practice the first technique that we covered, which is basic deep breathing through the day. Uh, so that's one. And then we talked about uh, emotions in the last video, and that is also to help you feel better and change your emotional states. If you follow the instructions that I gave you before, you're going to find out that it works and you end up feeling good. And you do this on a daily basis because you want to be mentally healthy or mentally uh, up, okay, rather than getting anxious or depressed or uh, any other mental condition that any of you may have out there. These methods or these techniques that I'm sharing with you help you balance them, and so that you can function much better through your life. Again, if you're seeing a doctor, a psychologist, a therapist, uh, you should continue doing that also. And then if you're picking up additional strategies through here, great, practice them. Everything works together and everything is for good. So you should uh, feel better and get better a lot quicker and more stable, more consistent. So today, I want to talk about this topic of holistic healing. Let me advance the PowerPoint a couple of slides here. Holistic healing has to do with the fact that in order for me to heal any condition, any illness, any sickness that I have, but very especially mental illness, the healing has to be holistic. Holistic means your whole being, okay? And so what that means is you need to be able to take care of your mind, your body, and your spirit. And I just noticed the last letter on spirit and body got a little thrown off in the PowerPoint as I loaded it up to the presentation. So forgive me for that. But holistic healing means I need to look at myself holistically, meaning my mind. I know my mind is my thinking cap, my and it's in my brain, right? But the brain is also physical, so that's the brain is part of the body. So your mind is one component, your body, the physical you is another component, and your spirit is another component. And uh, we're not necessarily talking religions, or also, although if you practice any sort of spiritual beliefs, it's good that you subscribe to them and that you practice them because they will help you also spiritually. But the other area where we refer to as your spirit is your emotional states. Okay, and that's why I gave you this quick technique last time of going to a safe place. So, so today, and again, the relaxation technique that taught you in the very first episode, which is just basic breathing to relax and calm your nerves, calm your brain. Your brain functions a lot better, which is where your mental health resides, correct? All right. So then in the body area, we have uh, two basic needs to keep that area healthy. And so this way you can see that all of you is becoming healthier. So the two areas in the body aspect, the physical aspect, are nutrition and exercise. So today I just want to talk about exercise. If you are already exercising, okay, then great for you. Keep doing it. I work with a lot of clients that suffer from mental illness, and they don't exercise consistently. They may exercise when they feel good, and so they feel motivated to go to the gym if they have a subscription, or to go out and walk, or just do exercises that they do. The thing is, when you are feeling an episode coming, that's when you more need to exercise. Okay, so let's say, for example, a person who suffers from depression. they see the episode or they feel the episode coming, and they allow themselves to get into the depression. Once you're depressed, of course, you're lacking motivation, right? And depending how severe the depression is, uh, you you probably even want to rest and be in a dark room, depending how uh, bad the illness is or what level the illness is. So that's when you need to most exercise. But because what you need to do is build the awareness, and we're going to talk about that also as we move on. But what you need to do is you need to be aware of when you feel an episode coming, okay? And if you have been exercising before, by all means, and please, when you are feeling that you are going into the phase of whether it be becoming anxious, becoming depressed, bipolarity is another mental illness that is very common, especially here in El Paso, Texas, where I live. But when you feel the episode coming, that's when you need to exercise. Okay. So let's say that you feel it more. Okay. Then I know it takes effort, but you need to go out to the light because the light is healthy, the sun is healthy, and walk or do exercises, whatever exercises you do, push-ups, pull-ups, jumping jacks, aerobics exercises, or maybe strength exercises. But you need to keep exercising even if you don't feel like it. An expert in arthritis and rheumatism says the time to exercise is when you're in pain, because that exercise is going to help you relieve the pain even though you don't feel like doing it. Just push yourself to do it, and it'll help you with the pain. Well, same thing with mental pain. Okay. If you exercise, what happens when you exercise is you're bringing a lot of oxygen into your body because you're breathing deeper, you're breathing more volume of air inside into your body, which turns into oxygen, and it gets into your bloodstream, purifies your bloodstream, moves all the way up. Exercise does that. It moves it all the way up to your brain, and then you start feeling better. So I'm going to leave you with that thought, okay? Because I see it way too often. People who suffer from mental illness, when they start feeling the episode, they go into the episode and they stop doing the healthy things and the good things that they do. When that's when really you should do it more, okay? So exercise. If you're not exercising at all, just get out and do some exercise, okay? I mean, or even if it's in the house, but you need to move around, walk around, jog a little bit. Uh, the prescription is usually exercise of an hour or 34, 45 minutes if you do it every other day, or at least 30 minutes every single day. If you develop the habit of exercising, you will know, your body knows, your brain knows, and you get used to exercising even when you don't feel like it. So you're developing a habit, okay? So exercise is critical for your mental health. Please pick up some sort of exercise program, check them out. YouTube has a lot of exercises, yoga, tai chi, weightlifting, any kind of exercise that you prefer. But please, if you're not exercising routinely, you need to do that for your mental health. Thank you for listening to me, and I'll see you in the next video next week. Have a good week. Bye bye.